Okay, welcome back everyone to another episode of MedChat Monday Healthcare Specialties Series. Today we are going to learn about the field of hematology and oncology. And now there's an acronym called HEMONC. So if you're interested in this field, it's super interesting. It's a pretty long training, but we're going to dive into what this field is all about with Dr. Jane today. So Dr. Jane, welcome to the show.
Thanks for having me.
So we know that you're a HEMONC specialist. Tell us a little bit about yourself. Why, before we learn about HEMONC, tell us why did you even pursue a career in medicine? Why become a doctor?
Sure. So that is a question I'm sure most people who you talk to have answered a million times. For me, my dad is a surgeon, and so I grew up in a surgeon's household. And my parents always told me that if you decide you want to do medicine, that's fantastic. Just make sure you're doing it because you want to do it, because it's a lot of work, takes a lot of time, and it's going to take a lot of your life, even after you're done with all your training. So I was entering into the medical profession with my eyes wide open when I started. I used to round with my dad on the weekends, and I loved the interactions he had with his patients. I loved the fact that he would run into his patients in the grocery store, and they would hug him and say, "You saved my mother's life," or "You saved my life." And it was just, he knew about them, they knew about him, and it was a really amazing thing to see that he'd had an impact on so many people's lives. So from a young age, I knew I always wanted to be a doctor. When I was in medical school, I couldn't figure out what kind of doctor I wanted to be, because I thought I wanted to be a surgeon, but then I really enjoyed endocrinology, I really enjoyed critical care, cardiology, neurology. I basically liked everything. And so I talked to some mentors, and I found out that if I went into internal medicine, it would give me the highest possibility of kind of subspecializing into a variety of different fields, and it would give me that time during residency to figure out what I really wanted to do. Now, after internal medicine, unless you do another residency, you can't really go into surgery. So I had to decide first if I really wanted to be an internist at heart or if I wanted to be a surgeon. So I decided to go into internal medicine because I really loved the patient-doctor interaction and the longevity of relationships that I saw most people in internal medicine subspecialties had. And then my second year of residency, I was on the oncology service, and the relationships that these oncologists were forming with their patients, I thought was amazing.
If I may ask, could you define for the listeners what hematology oncology even means?
Yeah, absolutely. So hematology is a study of blood disorders and blood cancers. So it ranges everything from more benign issues like iron deficiency, anemia, and sickle cell disease to cancers, so leukemias and lymphomas. Oncology is cancer that is the typical traditional solid tumors, so like lung cancer, breast cancer, colon cancer. So that's how hematology and oncology is kind of split up into two subspecialties.
Now, when you started medical school, did you even understand that there was an option to do hematology and oncology, or was this something that you discovered in your didactic years as a medical student?
So I learned a little bit about it as a medical student just because I knew oncologists. I didn't know all the details of how many years fellowship was, if I needed to do both heme and onc fellowships together. So I didn't know any of that. And I didn't know I wanted to be an oncologist until residency. So I didn't really dive deep into finding out about it until then.
So where were your interests when you were in medical school? Where do they lie? Because you didn't even know that was really truly an option until you became a resident.
Right. So I actually initially at one point thought pediatrics, and at another point I was thinking, surgery. So as I was going through rotation through medical school, my third and fourth year is really when I started to hone in on the fact that I wanted to deal with adults and I wanted to do medicine. So yeah, I didn't know. And then oncology, I didn't know I wanted to do really until residency.
So tell us a little bit about your third and fourth year rotations. I mean, you knew you were going to go into internal medicine. How did you prepare? Were there certain rotations that you did and you said, I love this, I'm enjoying this?
Yeah, I talked to people who had already gone ahead of me. I talked to residents. I talked to fourth year medical students. And third year, the curriculum is kind of set. You have your required rotations, your internal medicine, pediatrics, the rotations you have to go on. But for your fourth year electives, I wanted to make sure that if I decided to do internal medicine, I was going to have the most bang for my buck in that 1 year. So I did a pulmonary critical care rotation because I was told that being in the ICU is very important when you go into residency because you need to know how to manage these patients. And so any leg up you can get would be helpful. I did a rotation actually with anesthesia because I wanted to learn more about how they manage patients in concert with medicine physicians. And I did an endocrinology rotation because basically all the residents I spoke to said these are things that you're not going to focus on your intern year. And if you know about them already coming in, you're going to have a leg up on your co-residents.
Did you ever do a hem-onc rotation or a hematology rotation or an oncology rotation to give you some exposure when you were in medical school?
I did not because I didn't know I was interested. So the only exposure I had was if an oncology patient would come onto my service.
So what would you say to a medical student interested in hem-onc? Because the whole purpose of this video series is to inspire future doctors to pursue fields that they're interested in. Now, if we're exposing them to hem-onc now and they're a first-year student, what would you say to that first-year medical student?
So I would say if you're interested, there's so many ways you can get involved. So as a first year, you can reach out to a hematology or oncology physician and say, hey, do you think I could shadow you in your clinic? Because really, hematology and oncology is primarily practiced in the outpatient setting. Patients get sick and they end up in the hospital, but the majority of what we do is in the clinic. So I would say that'd be number one, reaching out to a physician or finding somebody who would be willing to have you come to their clinic a couple of times just to get a feel for what it is. If you're interested in research, oncologists and hematologists are always looking for enthusiastic medical students to get involved in research projects. I have 6 or 7 projects I could throw to people right now if they were interested in it. So
I hope you guys are listening.
So reach out to me. But I think it's really important to get that exposure because you want to figure out if this is something that you're interested in because the science behind it is so fascinating, and that is something you need to be interested in if you're going to pursue a career in this field.
How important is it to do research in medical school? I mean, we'll get to residency, but in terms of medical school, how important is it to do some research to eventually, match into an oncology, or hematology oncology fellowship?
So I think it's important even more than for matching, just so you get that experience, because when you're a medical student, you have more time. You don't feel like it. Your first 2 years, I remember, you do not feel like you have the time. But you have more time to actually sit down between like your first and second year and do a large retrospective review or actually really dig in and figure out if this is what you're interested in. And so I think it's important for your career development. Definitely, it's good to put on your CV, good to put on your ARIS, good to put on your applications. So it's very helpful in that sense. You don't need to be doing basic science bench research, even doing the clinical research, so retrospective studies with a mentor. They can not only help with your CV and help you look like you're interested in research, they can also help you learn some very important skills that will make it easier for you to do research as a resident and as a fellow if you're interested in it. And it will put your name on the radar of physicians who know that you are an ambitious and active student who's interested in moving science and oncology and hematology forward. So it can help you in so many different ways on top of helping with your applications.
Dr. Jane, what do you love about what you do every day?
Oh my gosh, so much. So much. It's really, people always say
because it must be very rewarding. I mean, you're helping people who are really in critical need, and you're applying the latest technology to really saving their lives. I mean, that must be very exciting for you and also very rewarding.
It really is. I mean, there's been so many changes in oncology, even in the last 5 years, where immunotherapy, which is a new way of treating cancer, has basically exploded on the oncology world. And so we've had all these patients who were able to help them live 3, 4, 5 years when before they would most likely not live more than a couple months. Not only that, is very rewarding, getting people cured, getting people, getting them to see their grandchild's bar mitzvah or whatever. You get the opportunity to really impact people's lives, which is so exciting. And then on top of that, you have to really be somebody who connects with people and is able to talk to people, because there's a lot of conversations that are hard. You have end of life discussions, you have goals of care discussions. You have to talk to patients about the treatment isn't working and what do we do next. And so we're very lucky in that we have this opportunity to connect with patients and have these conversations and help guide them into the next step of life. And sometimes that's end of life, and sometimes that's hospice and palliative care discussions. But that's sometimes the most rewarding patient interactions I have.
But is that what makes the field so tough? That you're talking to young people or even old people about, very serious topics.
It absolutely can. It can make it very tough, and you have to have the emotional maturity and the emotional intelligence to be able to handle that type of conversation. But it also can be so rewarding. I mean, even my young patients, when we talk about things, we talk about what they want to accomplish in their lives. We talk about, they may not have very long, but we talk about what they want to get accomplished. And I try to help them figure out how they can do that. So it's a very special relationship we have. It can be very emotionally charged, and it can be very emotionally difficult, but it can also be very rewarding.
So who is this field for hematology oncology? Who is it ideal for? What's the perfect candidate in terms of, do you have to have a certain personality?
So I don't think so. I don't think there's a perfect candidate, because you can actually do so many things within the field. So let's say you want to be a clinician and you really love that doctor-patient relationship and you really love that interaction. You could be primarily clinical, and you could do that 100% of the time. Let's say you're somebody who's more interested in the science, and you say, I'm really fascinated by these huge changes that are happening in oncology. If you're that person, then you can spend the majority of your time doing research or moving the field or making groundbreaking discoveries and spend less or no time in patient care. Let's say you're somebody who's really interested in how the pharmacology of these drugs are, how they work, how you can better improve them, how you can come up with trials to change cancer care. You can work in industry. So industry would be working for a pharmaceutical company. So I don't think there's one specific kind of person. I think the very cool thing about this field is really you can want to do anything other than surgery, and you can find a way to really be fulfilled with whatever your goal is, whether it's patient care or research or anything under the sun, really.
It sounds like the breakthroughs that are happening in oncology are really making the field very exciting and enticing to be a physician in this day and age.
It really is. In the past, people used to make fun of oncologists because we'd get excited if a study showed someone would live an extra couple of weeks, and people would say that's not really that impactful. Now we're seeing studies where these therapies are letting people live years longer than they were before. And that is very exciting to be able to tell my patient, 6 months ago, I would have told you this, but now I have this potential treatment that could help you live years. You could see your next set of grandchildren go through high school. And that is something that is really exciting in the field.
So let's go back to those medical school years. So you have to apply for an internal medicine residency, correct?
Correct.
And that's 3 years.
Correct.
So if you were to go back, is there a particular internal medicine program or types of programs you should apply to, knowing that you might ultimately go the hem-onc route?
So I think to be a good hem-onc doctor, you need to be very strong at internal medicine. So I would say it's really important to find a program that has a very strong internal medicine program. When I say a strong program, what I mean is, one, good mentorship. So the residents there feel like they're supported. They feel like they have mentors who are able to guide them and help them through training. Autonomy. So I went to University of Illinois, and as residents, we had so much autonomy as residents. And I think that made me a stronger clinician because I was forced to make decisions. And those decisions were, yes, I had an attending who was supervising me, but the decisions were ultimately me. And so I think that is incredibly important. So a strong internal medicine program is really important.
And why is that important? You say it's important, but why?
So a lot of hem-onc, you need to know medicine. When you're treating patients with cancer, you need to know that there are a lot of medical issues that come up. So, my patient who has pneumonia, I need to know how to treat pneumonia. I need to know how to treat a hospital-acquired pneumonia or a community-acquired pneumonia. And I need to have that strong internal medicine background in order to be good as an oncologist. So find a strong program. It does not necessarily mean it has to be someplace that has a hematology oncology fellowship. Some medicine residency programs don't have that fellowship, and I don't think that should be a make or break for you as to whether you want to go into that residency program.
Understood. So when you start your residency and you say, okay, I want to do hem-onc, should you get involved in research? Should you go to conferences? What's the approach that you would recommend to an internal medicine resident who's thinking about a fellowship ultimately in hem-onc?
As soon as you know that's what you want to do, reach out to one of the oncologists, the one who you think is going to be the most likely to mentor and sponsor you, and say, this is what I want to do. I would really love to get involved in whatever capacity you think would be helpful. If they don't, sometimes they will say, oh, I've got these 6 projects you could be on. Sometimes they'll say, I have no idea. And then you tell them, okay, well, is there any research? Or if you don't have any research, is there someone else who I can contact about research? If they don't know or if they don't have the opportunities, you can reach outside of your program even. Social media gives the opportunity to reach out to oncologists across the country. Now, remember, as a resident at one program, it's less likely that you're going to get an oncologist who's going to be able to cross-collaborate with you, but it happens all the time. I have projects with people from multiple institutions. So I think the first thing is just finding that mentor. The second you know that this is what you want to do and saying, hey, I'm here, I'm motivated, tell me what you have that I can help with. Or if you have an idea, say, I have this idea, is this a good idea? Would you be able to help me implement this research project?
So Dr. Jane, it sounds like what you're really recommending is definitely find an oncology mentor, and research is going to be vitally important when you apply for these fellowships.
It will definitely help you. It will not hurt you. So getting research somewhere on your CV or somewhere on your application will only help you.
Okay, so take us through those internal medicine years. At what point in those years did you say, you know what, I want to go the hem-onc route? Because I know you mentioned you didn't really discover that until your second year.
So my second year, I was on a rotation, and I just saw the way that doctors and patients interacted. I started learning more about the innovation that was happening in hem-onc, and I said, I need to do this. So I reached out to one of the oncologists, and I did some research. I did some research projects, but I also worked with him on creating this breast cancer website for patients. So I had not only research in my pocket, I also had this kind of unique project that I worked on where we were educating patients, and it was an outreach project. And so at every fellowship interview I had, someone brought that up. So if you have an idea for a cool project, if it's a quality improvement project.
Or education, as you did.
Educating patients, educating other physicians.
Just to show that you're interested in the field, you're trying to move the ball down the field. You're emphasizing patient education, which I think is as important as bench work.
Yes.
So that's vitally important. Did you do any away rotations or attend conferences?
So as a resident, I didn't do any away rotations because it wasn't really an option at that point in my program, but I did attend conferences. So I went to the American Society for Clinical Oncology, which is the big national conference that happens in Chicago once a year in the spring, usually last weekend in May, first weekend in June. So I did attend that. I also submitted my some abstracts for presentation. So when I was accepted to present like a poster, I went to those conferences as well. There's also the American Society for Hematology, or ASH, and they have a conference every December, which is in a different location. But there's a lot of opportunities for oncology and hematology conferences.
What do you think these fellowship directors are looking for in applicants, and how many spots are there usually in a fellowship program?
So each program has anywhere from 2 to 4 spots usually. The average is 2 to 3. And people are looking for motivated residents who've shown clinical acumen. So you need to get a recommendation letter from an oncologist who says, yes, this person is good for this field. They're looking for research. So they're looking to see if you've published, or even if you haven't published, if you've been working on a research project. They look for interesting outreach projects like the one I mentioned. Volunteer opportunities, if you volunteered in a hospice or a palliative care program or someplace, there's a lot of opportunities for that. They also look to see if you've presented at any national conferences, any of your research case reports, case series, things like that.
And they want someone who's going to really connect with patients, right? Because you're going to be connecting with patients who are going through really serious things, and they want to make sure that you have that personality to connect with the patient correctly.
Absolutely. You need to be able to talk to your patients and have, difficult conversations sometimes.
How long is the fellowship?
So it depends. So there's a very few programs in the country where you can do only hematology or only oncology, and those are 2-year fellowships.
So usually the fellowships are combined with hematology and oncology.
Correct. Usually they're combined, and usually it's a 3-year fellowship for the combined hematology and oncology.
And do you recommend that over doing a focused hematology fellowship or a focused oncology fellowship? Do you recommend doing a merger of the two disciplines?
So I think it's good, especially if you're not sure what you want to do when you're done with fellowship. If you're somebody who says, I want to be a sarcoma expert and I want to only do sarcoma and I want to do research in sarcoma and that is my field, then I would recommend doing one of the 2-year programs that's just oncology or just hematology if you want to be a leukemia expert.
Yeah.
But if you don't know that going in, if you don't have that experience or that drive to do one specific thing, then yes, I do, because it gives you a much wider idea of what all is out there, and it gives you a much more robust education in both hematology and oncology, which oftentimes overlap.
Now, when you get to your end of your fellowship, do most of the doctors, do they go the inpatient or outpatient route? Do some of them go biotech? What's the common trend right now in terms of where the HemOnc fellows end up after their training?
So I think it depends on the program, and it depends on the location, and it depends on the person, really. Some people go into academic medicine. So I'm an academic oncologist, so I'm at a university. Some people go private practice, so they'll primarily be clinical, and they'll either be owned by a hospital or they'll own their own private practice with a group. And some people go into industry, so they go into pharma or they go into other innovative things. So I think it really depends on the person and what they get out of their fellowship and what they want to do.
Do you see an equal amount of men and women in the field?
I do. I think it's pretty equal. I don't know the exact numbers, but I think it's pretty close.
And how's the life-work balance in terms of being a HemOnc?
So the great thing is you can kind of decide how your life-work balance is going to be depending on if you go the academic route, the private practice route, or the industry route. And then when you're there, most oncologists in whatever field, the majority of the time they see patients at a maximum 4 days a week to give 1 day of kind of administrative day. But if you're an academic, you see patients a couple days a week, you balance it out with meetings. So like for me, when I take call, my call is home call, so I don't really have to come in the evenings or nights. I just take pages at home for my patients. When I'm on call on the weekend, I'll come in, round on some patients, and that'll be the extent of it. Some hospitals, you're on call with your group, and you split it up, so it'll be 1 in 5 weekends. Some places it's 1 in 10 weekends. So it really depends on the practice style and the practice model that you're working in.
And what's a typical day for you in terms of what is a typical HemOnc day for a fellow or someone who's finished their fellowship?
So when you're practicing, if you're primarily clinical, you'll be seeing patients in the clinic the majority of the day, from whatever time your clinic is, say 8 to 4. And you'll see however many patients. And if you're a general HemOnc doctor, you'll see a variety of disorders. So anything from iron deficiency anemia to colon cancers. If you are a subspecialist, so for example, I am a GI oncologist, so I'll be seeing colon cancer, pancreatic cancer, neuroendocrine tumors, so things that are specific to GI oncology. When we our patients get admitted, sometimes we see our patients in the hospital. Sometimes it's your partner is covering the patients in the hospital. So it really depends on the practice and how you have it set up.
Dr. Jane, what would you say to a medical student who's just starting out but interested in HemOnc? How would you inspire them to pursue hematology oncology as a profession?
So HEMONC is so rewarding. People think that it's depressing. People think it's frustrating, and it can be. But it is more than anything. It is so, so rewarding. I mean, I love what I do. My patients are so appreciative. Their families are so appreciative. You really become a part of their lives. I always tell my trainees, the conversations that you have with these patients, you may forget them, but they remember them for the rest of their lives. And you really become a part of their team and you become a part of their family. And I think that is such a special relationship to have. Plus, the science is changing so much that I'm really able to offer some things to some patients that have changed their lives. And
medications that didn't exist when you were a medical student.
Exactly. I mean, it's really mind-blowing. I've had patients who had bucket lists that they finish their bucket list and then come to me and their biggest stress is, what do I do now? I finished my bucket list. I mean, that's something that I never would have thought I'd be able to do with a patient. So it really, in my mind, it really throws medicine back to how it used to be practiced, where we have these long-term relationships. The longevity can be there, and you develop a really close connection with your patients.
Dr. Jane, you are an inspiration, and you are truly impacting the lives of people. You're on the front line, and I hope that the medical students or the pre-med students or even the internal medicine residents listening, I hope that they are inspired to consider HEMONC as a profession. The profession is changing. There's a lot of great technology where you can impact people's lives in a very positive way. And this was a very inspirational interview to have with you. So, Dr. Jane, thank you. Thank you so much for taking time out of your busy schedule and taking time away from your patients to speak with us and inspire a future generation of HEMONC doctors.
Thank you so much for having me on.
Thank you.